Guys, welcome to our press briefing, but please, we apologize for this delay. We actually got ready, but due to some technical error, we could not be able to make it. So we apologize for this delay, but nevertheless, welcome to our briefing.
Thank you again, members of the Fourth Estate. Just to repeat what Mutua has said, we do apologize, and karibuni to our briefing for the day. This is our 117th briefing. Good afternoon and welcome all. Fellow Kenyans, the coronavirus disease is now fully domiciled in our communities, as evidenced by the surging numbers which we have been reporting to you in the past few days. Like we told you yesterday, these figures will keep rising, something that should worry each and every one of us. And of particular concern is the rising numbers in Nairobi County. The capital city continues to lead with a number of infections, and as of yesterday, Nairobi had 5,705 cases, followed by Mombasa with 1,739, Busia coming in third with 550 cases, and Kiambu fourth with 520 cases. And in the last 3 days alone, Nairobi has registered 518 cases, and this indeed is a worrying trend, and something must be done. It is important that the residents of Nairobi are alert and are able to act very quickly in terms of adhering to the containment measures. It has also come to our attention that some Kenyans have resorted to stigmatizing those suspected, even those who have contracted COVID-19. And really today the aim of our press briefing is to highlight and to have a discussion on stigmatization when it comes to COVID-19. The behavior by some of our people in different ways, exemplified in different ways. We've seen people taking pictures, recording videos of ambulances and vehicles ferrying patients. We've received several social media forwards of people, depicting COVID-19 as a cause of different events in the community. And worse still, we've seen people even sharing pictures and videos of COVID-19 patients. And this has ended up leading to profiling of the infected people. And it's important that we know that this is highly unacceptable. We need to remember that coronavirus is a disease, and getting this disease is not a crime. And those who are infected with this disease are not criminals. And therefore, it is important we note that this virus can indeed be contracted by anyone. The high and mighty in society and everyone else in society, we've repeated over and over again, anyone can get this disease. And so it's important that we take care of each other and we avoid stigmatizing those who have the disease or those who may be affected by the disease. We'd also like to make a passionate appeal when it comes to the profiling of COVID-19 patients. We've seen different people discussing, symptoms of COVID-19 patients, areas in where they might have contracted, profiling them and elevating, stigma in the society. Again, this is something that does not add value to this fight of COVID-19 and ends up stigmatizing the situation and making it even harder for us to be able to maintain our containment measures, for us to be able to work together, adopting a whole of society approach in dealing with this disease. It's important to note, COVID-19 is a disease like any other. It's a disease like any other, and we really need to emphasize this. And it is important to note that stigma really will not go a long way in terms of combating this disease. It's important we continue to remember to maintain the containment measures, washing our hands with soap and water, maintaining physical distance, wearing a mask at all times in public spaces, and avoiding all forms of gathering. These indeed are the only weapons that we have against the disease at the moment, and once we follow them, we shall be able to remain safe and to be able to reduce transmission of this disease. With regards to our COVID-19 situation, today, 497 people have tested positive out of a sample of 4,922 samples tested within the last 24 hours. This brings our total caseload to 10,791. And so far, cumulatively, we've done 234 tests cumulatively. Of the positive cases, 480 are Kenyans, while 17 are foreigners. 318 are male, and 179 are female. The youngest is a 2-year-old child, while the oldest is 89. And in terms of distribution, like we've started today, again, Nairobi continues to lead with 292 cases. We have Kiambu with 62, Kajiado with 51, Machakos with 30, Mombasa with 28, Busia 10, Uasin Gishu 8, Nakuru 5, Makueni 3, Narok 2, Nyeri 2, Meru 2, while Kakamega, Kericho, Kilifi, Laikipia, and Nandi all have 1 case each. In terms of sub-county distribution, we've provided you the information out of all the counties that have positive cases today. And to highlight a few, in Nairobi, out of the 292 cases, 39 are from Westlands, whereas 35 are from Langata. Dagoretti North has 34 cases. In Kiambu, out of the cases mentioned, 13 are from Kiamba. Gatundu South has 9, Ruiru has 7. In terms of Kajiado, the cases highlighted, a highlight of that, Kajiado East has 29, Kajiado Central has 5, and in terms of Machakos County, we have Athi River having 29 and Machakos Town having 1. Whereas in Mombasa, Mvita has 14, Jomvu 9, Likoni 2. And in Busia, Teso North leads with a number of cases. In Makueni, it is Kibwezi West with the 3 cases there. We are delighted to inform you that today 71 people have been discharged from various hospitals, bringing the total number of recoveries to 3,017, and we thank our healthcare workers for this achievement. Regrettably, we have lost 5 more patients to the disease, bringing our total cumulative fatality to 202, and we send our heartfelt condolences to the family and friends of the bereaved. And again, we would like to reiterate that this disease does not discriminate in terms of color of your skin, status in society, membership, your affiliations in terms of religion, politics. Indeed, this disease can get each and every one of us wherever we are, meaning we are all at risk, and we can avoid it by keeping vigil, especially of our surroundings, adhering to the containment measures, washing our hands with running water, masking, ensuring that there's physical distancing. And that the only way to overcome it is if we observe these measures, and together we do believe we shall be able to overcome. Thank you. Questions, please.
Any questions? Graham?
Hi, Graham from The Standard. I would like to know what is the challenge that you get in handling critically ill patients? What are the regimens that you use? What is the survival rate? And what is your take on the increase in the number of critically ill patients?
Good evening. My name is Emmanuel Tov from KTN News. Just one question. The International Labour Organization listed COVID-19 as an occupational health hazard, and that those people who get COVID while at work should be compensated, or something should be done for them. Is the government buying this, and are those people, the medics who've contacted COVID-19, being compensated or given anything? Thank you.
Nancy Okware from KBC. Yesterday we recorded the highest number of fatalities, standing at 12, and out of those 3 were community-based fatalities. So my question is, are they people who are actually undergoing the home-based care protocol, or there are people who did not know that they had the coronavirus, and after succumbing to the virus they were tested and found out to have been positive? And my final question is on the home-based care protocol. So far, how many people have recovered? Thank you.
Yes, I am.
I'm Hayamba from Ebro TV. My question is concerning the latest cases. Out of the 497 confirmed cases, does this include the 41 staff at the Pumwani Hospital? And then I understand the highest number so far we have actually tried to test is a maximum of about 4,000. Is there any plan? Maybe the government is trying to extend this figure maybe to around 10,000 in future?
Great. I think we can take that first round. Graham asked, what challenges do we face while handling critical ill patients? And in regard to this, one of the main issues is the critically ill patients of COVID-19. As we've mentioned time and time, most of them do have comorbid conditions. And so by the time they present to us, you're dealing with a patient who perhaps is diabetic, hypertensive, and that always brings about a conundrum when you're trying to manage such a patient. Additionally, the disease, if we can remember way back about 100 days ago, we thought that this disease was primarily a disease that affects the chest or the respiratory area of your body. New evidence is emerging from across the world that this disease is actually a systemic disease, a disease that has effects on your heart, a disease that has effects on your kidneys, a disease that has effects when it comes to the clotting of your blood and the coagulation of your blood. And so you can imagine in terms of critical ill patients, we're seeing a mixed picture, and the DG will emphasize more on this and elaborate on this. I'm familiar with patients who've presented with clotting issues. I'm familiar with patients who've presented with, managing their comorbid states as well as managing COVID-19. We are familiar with patients who seem to be presenting with inflammation of the heart. People who are not hypertensive, people who are not diabetic, people who don't have any other comorbid condition, but COVID seems to be affecting their heart, therefore making it even that much more difficult when it comes to managing a critically ill patient. What we can say, however, in terms of our different facilities across the country, particularly facilities that have perhaps now experienced more of the critically ill patients, I'm talking about Aga Khan, I'm talking about KU, KNH. These facilities right now do have one of, the most experienced health workers when it comes to managing a COVID critically ill patient. And the healthcare workers there continue to inform us that they are able to, do the best that they can, offering world-class care to the patients that we get. Of course, over the time, we've emphasized that the ICU bed is critical. Getting ventilation support is critical. But like raised by Graham, we are seeing other presentations beyond the need for that ventilatory support. And so as we go about the disease, as we try to manage this pandemic, and as new information becomes available, we'll continue to manage the patients as best as we can, and we are doing a good job of that. It's interesting to note, perhaps, and the DG will emphasize here, I'm aware of some good survival rates in some of our hospitals here in Nairobi, especially at the ICU level, where we've even had discharges home from ICU. So our healthcare workers are doing a good job. Emmanuel Tor asks a question on occupational health hazard. Are we recognizing this much like the way ILO has recognized it as an occupational health hazard? And what we're doing here is reviewing to see what that would mean in terms of the fiscal space, in terms of allocations for that. And there are teams looking to see, in terms of Kenya, workmanship hazards and compensations, what can be put in place to ensure that our healthcare workers are protected. What I'd request is once the teams finalize looking at this, we'd be able to then firmly communicate and confirm if this would be provision that's allowable for our healthcare workers here. In terms of Nancy Okwaro's question from KBC, community-based fatalities, the DG will give more information. However, what we do know, and as we've emphasized over and over again, home-based care becomes quite critical in our country at this point. And we've seen, success cases. We'll be able to share with you the numbers at that. But remember, this is, again, back to individual responsibility. It is about adhering to the criteria of who can be in home-based care and emphasizing that home-based care is not for the moderately ill patient. It is for the asymptomatic or mildly ill patient. And so we are confident that this program will continue to be of aid in the country. Kaimba asks, out of the 497 confirmed cases today, have we included the 41? I think, again, the DG will be able to emphasize this. I'm aware he actually addressed the media on this earlier today, so he will highlight on that. But Kaimba, in terms of the highest numbers ever tested, DG, I think we've gone beyond 4,000. We've been at 7,000, so we always keep tabs at this. So we are inching closer to that 10,000. Bwana DG, you can add on.
Thank you, Madam CAS. Just to add on to question 1 regarding the critically ill patients, again, one of the challenges, of course, is the cost. On average, if you were to land in ICU for critical care, we spend close to 71,000 shillings or thereabouts to manage you on a daily basis. 65% of that is contributed to by the PPEs. But on top of that, of course, these are people who have comorbid conditions, and that makes the management more complicated because of the kind of presentations we get in COVID-19 cases. Some of these things which Waziri has alluded to, including the challenges that you'll face with the respiratory system, so you require ventilatory support. That being an invasive procedure puts you at risk of getting secondary bacterial infection in the respiratory tract, which of course complicates your management. Of course, also because of these underlying conditions, you find that these patients end up with multiple organ problems leading to what we call multiple organ failure. So when the lungs begin to fail, in sympathy the kidneys also slow down, the heart slows down, and you require to support all these organs. Of course, the kidneys, you require to do the hemodialysis to be able to remove the toxins. For the heart, you need to give them medicine for them to be able to maintain good blood pressure for circulation and perfusion to continue. All these are very complicated procedures and processes which take a lot of time of the healthcare workers, and therefore if the numbers surge, then you may not be able to have the adequate ratios of healthcare worker to patient to be able to offer that service. Notwithstanding the clotting problems that these people have, the cytokine storm, where your body in trying to fight the infection overdoes it and therefore puts the rest of the organs at risk. Now the beauty is that we are developing or generating data from our own homegrown cases, and we learn each and every day. So it's important that we do this capacity building, and we have daily webinars with colleagues from across the world in Africa, sharing experiences from US, Spain, China, Korea, and anywhere else. And I think going forward with all this information, if we can be able to bring it together, we'll only get better at managing COVID-19 cases. Our total cumulative cases of COVID-19 who have passed through the ICU is 199. Out of this, we have had 90 discharges and 73 deaths. As of today, there are 36 people in ICUs throughout the Republic. Out of these 36, 18 are on mechanical ventilatory support and 18 on oxygen. But the outlook is very good because now we have locally generated data. And of course, as doctors, the more you manage a condition, the more you get used to it. And therefore, you can be able to put in place interventions which will make a total difference. Nancy's question regarding the deaths, yes, these are community deaths, but these are community deaths not from home-based care clients. We told you that for home-based care, we are using a very judicious and cautious approach to ensure that those who go for home-based care actually qualify for home-based care and will undergo home-based care throughout the 14-day period. So these are cases of COVID which were diagnosed posthumously, that these people collapsed at home or died on arrival at the facility, and because of a high index of suspicion, then we go ahead to test for COVID, and then they turn out positive. Yesterday I think we had 84 people on home-based care. Of course, the data does not flow in on a daily basis because we have to get this data from all facilities. So the numbers that we disclose here will always lag behind the actual number of cases. But so far for home-based care, it has been good. Waziri last week we were in Kwale, and all the 4 people on home-based care are doing very well. Even the cases of Pumwani, the 41, 2 of them have been removed from home-based care from isolation totally. 39 are still on home-based care, but they are progressing very well. And I would like at that particular point to give you also statistics regarding the healthcare workers who have tested positive for COVID-19, who are 450. And one thing that could be working in our favor is, of course, our demographic profile. These are very young people. Out of these 450, 414 don't have any underlying problem. No wonder most of them are asymptomatic and they qualify for home-based care. Only 16 had hypertension, 6 of them had asthma, 3 people reported diabetes, 5 are HIV positive, 1 had hypothyroidism, 1 with cardiomyopathy, and 4 with other cases. So we are quite impressed with this, and we are hopeful that including the healthcare workers who are on home-based isolation, they are likely going to do very well. And all other patients that we select for home-based care, because of our young demographic profile, the outlook looks very good. It's not green. I've addressed the question of Pumwani. Yes, the 41 are part of this. We are there today in the morning to look at on a fact-finding mission, but also to support the county team together with the county health director for health services at Nairobi Metropolitan Services, and to be able to see the interventions that we need to put in place to ensure that the healthcare workers are safe. And my final appeal to healthcare workers is don't leave anything to chance. Please implement to the letter the information that you get from the case management team, from the infection prevention control team, so that you're not only safe for yourself, but safe to serve another Kenyan who may unfortunately come up with COVID-19. Thank you.
Bila shaka mpenzi mtazamaji, ni taarifa kila siku kuhusiana na masuala haya mazima, shughuli nzima ya virusi vya korona humu nchini. Na mpenzi mtazamaji, katika siku ya leo kwa faida yako ni kwamba visa 497 zaidi vya maambukizi ya korona vimeweza kuripotiwa, idadi ya wote walio na virusi hivi sasa ikifikia watu 10,791. Hii ni baada ya sampuli 4,922 kupimwa chini ya kipindi cha saa 24 zilizopita. Mtoto mchanga zaidi kupatikana na maambukizi ya korona ni wa miaka 2. Watu 71 zaidi, mpenzi mtazamaji, wameweza kupona na kuruhusiwa kwenda nyumbani. Idadi ya waliopona sasa ikifikia watu 3,017. Vile vile mpenzi mtazamaji, watu 5 zaidi wamefariki chini ya saa 24 zilizopita. Idadi ya waliofariki sasa ikifikia watu 202. Mpenzi mtazamaji, ni taarifa za Shina la Upeo. Tutakuwa tunakujuza haya yote ikitimia mwendo wa saa 1 na vile vile saa 3. Hivyo basi zidi kuganda na TV47. Wakwetu wananiita Joash Onsare. Tunazidi kufululiza zaidi, na ni kwamba wafanyikazi 41 katika hospitali ya Pumwani wamethibitishwa kuwa na virusi vya korona. 19 kati yao wakiwa ni wahudumu wa afya, huku 22 wakiwa ni wafanyikazi wengine katika hospitali hiyo. Akizuru hospitali hiyo mapema leo, mkurugenzi wa huduma za afya Daktari Patrick Amoth amesema kuwa hospitali hiyo haitafungwa, ila baadhi ya huduma zake zitafungwa.
Mr. Bengo, on a fact-finding mission to be able to see for ourselves what is happening in Umwami Hospital, and in view of what the director has indicated, of course we know we have had targeted testing. Staff members have turned out positive, and just generally to see the measures that the hospital has put in place. 1, to stop further transmission of the infection, and 2, to support the healthcare workers who have been affected in one way or the other during this difficult period. We have had fruitful discussions with the hospital management team, the measures that need to put in place, including infection prevention control like what you are seeing there. And I've been assured that we have sufficient quantities of PPEs, personal protective equipment. Further, we have agreed that beginning today, we'll have an isolation center dedicated for staff of the hospital at the School of Nursing for those who may not meet the criteria for home-based isolation. So basically ours is a mission of support and also fact-finding to be able to see what is on the ground and to assure the public that we are doing everything possible. 1, to stop further transmission of infection to the healthcare workers, but also the people who come to seek services here. So the hospital is safe. The staff who are working here are properly trained, and will continue to give them support in terms of capacity building in terms of proper gear, in terms of infection prevention control measures to ensure that as they work, they are not only safe when they are offering the services, but they also offer safe services to members of the public. So going forward, there's a remaining batch of about 100 staff members to be tested. Out of the 290 who are tested, 41 turned positive. All these 41 have been on home-based isolation. 2 actually have been discharged from home-based isolation care. And the remaining 39 are doing well. Nobody has gone to hospital for care. And we are hopeful that they'll be able to pull through without developing any symptoms of COVID. Remember, they qualify for home-based isolation because majority of our people are still asymptomatic. 90% of the infections we get in our setup are asymptomatic. Therefore, that gives us a very good platform to be able to implement home-based care interventions. And also because, home-based care is 9 times cheaper than institutional care. So we'll support the healthcare workers who are afflicted, but we're also going to work very closely with Nairobi Metropolitan Services to ensure that the facility in the School of Nursing is immediately put to use. I think that's all. Maybe I can open it up for a question and answer. Please tell us. Yeah, can you coordinate that on our behalf?
Na mpenzi mtazamaji, tukisalia na masuala ya afya ni kwamba katika kikao kilichoandaliwa na wahudumu wa afya, serikali imelaumiwa vikali kwa kile wanachokitaja kuwa serikali kukosa kusikiliza matakwa yao. Mpenzi mtazamaji, isitoshe viongozi hao wamesema kwamba wataanzisha ziara katika hospitali za kaunti kukagua iwapo wana vifaa vya kujikinga na korona, na iwapo hawana huenda wakasimamisha shughuli katika hospitali hizo.
We are going to take inspection of all health facilities in Nairobi, and we shall lay down a program to inspect all health facilities in the country. And those that we find do not have personal protective equipment, right from a dispensary all the way to Kenyatta, we are going to close them down. And we invite members of the media to join us. You cannot be sitting in Afya House saying you have personal protective equipment, and yet nurses in Pumwani and other health workers, they are highlighting nurses because the numbers is high. But we have even doctors who are infected. We have clinical officers, we have pharmaceutical technologists, we have support staff, we have even watchmen who are infected. So when we talk about health workers, it's the entire workforce within the health sector, including drivers.
The situation we're currently in, healthcare workers are the ones who are providing that service that is needed to enable the country go back to normalcy and to enable us eradicate the disease. So it is in bad faith that the Ministry of Health, and we know there are cartels there that have been talked about by the CS Honorable Kagwe. If you read those amendments, there is one office that is constantly appearing to try and control healthcare workers and get healthcare workers out of the councils that regulate health professionals. And we pass a message to you today. Do not start a war with healthcare professionals at a time when the country needs them.
Na mpenzi mtazamaji, tukiachana na masuala ya afya, tunaangazia masuala ya uongozi, na ni kwamba wawakilishi wodi wa kaunti ya Kirinyaga wameanza mchakato wa kukusanya saini za kumsambaratisha uongozi wa gavana wa Kirinyaga Anne Waiguru. Haya yanajiri siku chache tu baada ya bunge la seneti kutupilia mbali hoja ya kumbandua gavana Waiguru. Wawakilishi wodi hao wakiongozwa na kiongozi wa wengi Kamau Murango wamesema kuwa watakusanya saini 30,000 na kuwasilisha kwa Rais Uhuru Kenyatta. Na mpenzi mtazamaji, kwingineko ni kwamba kaunti ya Kiambu imetenga kituo cha karantini eneo bunge la Gatundu Kaskazini ili kuwahudumia wahudumu wa afya ambao huenda wakapatwa na maambukizi ya korona. Haya yanajiri baada ya wahudumu wa afya 257 kuripotiwa kupatwa na maambukizi ya korona tangu mwezi Machi.
We appreciate you. Your team are not only Tigoni, even the other level 4 facilities, the 4 facilities.
Fungua.
The last 7 days have been very, very stressful to us. And I sincerely want to thank our frontline health workers, led by our CC, Dr. Murega. It has been an extremely stressful week. We started off with a single digit, and we've not only gone to double digit, but double digits that are increasing at an increasing rate. I don't know what the figures today will be, and I don't want to know. Yesterday, we had 49 cases. The previous day, we had 33, and on and on and on. So the curve is rising.
Na mpenzi mtazamaji, sasa tunaelekea katika kaunti ya Kilifi. Wahudumu wa afya wanaowajibika na wagonjwa wa COVID-19 wanaendelea kupatwa na unyanyapaa kufuatia shughuli za kikazi tangu maambukizi ya korona kuripotiwa nchini.
Burnout zikikuja, tunabidi tuite wahudumu wa saikolojia. Wanakuja wanatusaidia kimawazo, wanatuongelesha wote, wauguzi na pia wagonjwa. Tushawahi kupata wagonjwa ambao wako in denial, inabidi tuwaitie watu wa saikolojia wakuje wawaongeleshe. Na upande wa staff pia huwa tunafanyiwa, kabla tuingie katika hilo jengo kuanza huduma, lazima tupitishiwe katika kuongeleshwa na majukumu yetu yanayotukabili mbele ya kazi tunayokwenda kukabiliana nayo. Stigma iko hata kwa fellow colleagues. The first time nilitumwa kwenda huko kwa isolation, wale wenzangu ninaofanya nao walikuwa hawataki kukaribiana na mimi. Kwa hivyo stigma iko na inatisha, kwa sababu ukiona wale watu unafanya nao kazi wanajitenga na wewe, na huu ni ugonjwa uko na hawa wagonjwa ni wetu, ni lazima tuwahudumie. Na mpenzi mtazamaji, tukizidi kusonga mbele ni kwamba zaidi ya waumini 70% wa kanisa la Legio Maria wanazidi umri wa miaka 60. Kanisa hilo linasema 90% ya viongozi wa kanisa hilo wanazidi umri wa miaka 70. Kamati ya uongozi wa kardinali linasema kuwa wataathirika pakubwa iwapo serikali itakosa kulegeza kamba ya sheria ya umri kuhudhuria ibada.
Shida atakuwa kwa maana mimi mzee ikibaki nyuma na watoto ndio wanakuwa kwenye kanisa. Sasa watoto atafundisha mzee kama mimi namna gani, atapata mimi wapi? Na watoto na vijana ndio wanakuwa kwenye kanisa. Tunaomba serikali yetu uangalie mambo ya wazee, atakuwa namna gani, mambo ya vijana vidogo atakuwa namna gani.
Kwa inasemekana ya kwamba palipo na wazee hapaharibiki neno. Tukikosa hawa wazee na vijana ndio waachiwe uongozi wa kanisa. Na kuna
Na mpenzi mtazamaji, tukiachana na masuala ya maabadi ama maeneo ya kuabudu, tunasonga mbele kukujuza zaidi ya vijana 4,000 kutoka maeneo ya vitongoji duni kaunti ya Trans Nzoia wamepewa nafasi katika awamu ya pili ya mpango wa kazi mtaani.
Hawa vijana mara nyingi sana wamekuwa wakishikwa na polisi, wanaangaishwa kwamba wanauza changao, wanauza busaa. Jambo ambalo nataka kuuliza serikali kuu na serikali ya kaunti, hawa vijana mbona siwapatie kitu cha kufanya waweze kuondoka katika hiyo kazi mbaya ambayo mnasema wanauza chang'aa, wanauza busaa.
Nashangaa sana, kuna jobu imetolewa hadi kazi kwa vijana mtaani. Sisi nimeshangaa kazi hajatupata sisi huku. Sisi tuko tu hivi kuhangaika tu kwa puya, kutembea tu. Hiyo kazi ya vijana ilikuwa inafaa tu itutokee tuipate pia, sina tufanye hiyo kazi, hata kama ni kufyeka area tufyeke area, sikukaa kila siku tu kwa puya.
Not all informal settlement will benefit at the same time. So first phase is gone. We are in the second phase, hopefully in the third phase. And we have requested the government, and we have done a proposal and recommendation for consideration of the remaining informal settlement, which we are hopeful will be considered in the next phase. The National Hygiene Program is to provide a form of social protection for workers whose prospects for daily or casual work has been disrupted by the containment measures and policies put in place to limit the spread of COVID-19. This program is also structured as a local economic recovery program which aims to restore disrupted economic activity in
Na sasa mpenzi mtazamaji, tunageukia masuala ya siasa kuzidi kukujuza. Siasa za magharibi zinaendelea kuchacha na makundi mbalimbali yanaendelea kujitokeza. Vuguvugu la vijana wa Musalia limejitokeza na kupuuzilia mbali mkutano ulioandaliwa Kakamega na Seneta Cleophas Malala kuwa sio wa ANC. Vijana hao wamedokeza kuwa vijana nchini watamuunga mkono kiongozi wa ANC Musalia Mudavadi kuwa rais. Wanasema Mudavadi ndiye kiongozi aliye na maono kwa vijana.
Musalia Mudavadi is not seeking to be the Luya kingpin. He is seeking to be the president of the Republic of Kenya. So, Youth for Musalia, as you heard from the statement, is a nationwide movement. And from the introductions you've seen, this is just a section of the membership. So, there is nothing like disunity. So far, if we are to talk about the Western region, as at today in the morning, the only Luya who was declared that is running for president in 2022 is Honorable Musalia Mudavadi.
Kenyan economy transformation of Kenya, in the 2002, His Excellency Musalia Mudavadi supported President Uhuru Kenyatta. In this 2007 and 2017 election, he did the same. Many have been seeing him doing that and saying that His Excellency Mudavadi is a coward. No, supporting someone else doesn't mean you are a coward. It means you have humanity in your heart, you are honest. You value others also, because he's not a selfish leader who wants to be for himself alone. So this has made us the youth for Kenya to come together so that we can stand with our leader, a leader who has the love of youth, a leader who identifies the youth. Because many youth right currently in Kenya are educated, have papers, but they are nowhere to be seen.
Mpenzi mtazamaji, dakika 25 zimeweza kukatika baada ya kugonga mwendo wa saa 10 saa za Afrika Mashariki. Asante sana kwa kuwa mtazamaji mwema. Taarifa hizi na zingine utaweza kuzipata itakapotimu mwendo wa saa 1 na vile saa 3 juu ya alama. Hivyo basi zidi kutazama TV47. Mtafsiri kwenye lugha ya ishara amekuwa Ann Wairimo. Wakwetu wananiita Joashua Nsare na kutakia ukuwe na utazamaji mwema. Kwaheri kwa sasa.